I'm Dr. Nichelle Gurley, specialized in prenatal, postpartum, and pediatric chiropractic care, along with prenatal and postpartum fitness and rehab. We're going to review posture during pregnancy. The most common things that happen during pregnancy are a rounded back because we're fatigued, a rib flare that commonly happens, a excess curve of the low back like this, which is like kind of the classic you see because the bump is pulling out. Sometimes people tuck under their sacrum, and then looking at the feet and seeing if they're collapsing inward. And there's some exercises that I have on YouTube that can go over what exercises you can do to your feet to help regain that arch that's flattening. For the other portions, the best cue that I like to give is thinking about a string being pulled up through the top of your head. So if you're pushing another kiddo and you find that you're kind of slouching, think of that string to pull you upright. It's so easy to fall into these poor patterns because we're tired, we're uncomfortable, but try to remember we're going to be more comfortable if we use those cues of pulling up through that string. There's some other things as well. So if you're noticing that you have a big curve in the mirror or that you're tucking under, I want you to excessively curve and excessively tuck under and try to find that in between. You shouldn't be butt clenching. That's going to be something you want to stay away from. And you shouldn't be feeling like your belly's sagging out too much. So find that neutral. That's where you should be standing. The other thing that I see is a big rib flare. So we're wanting to kind of stand like this. Think about your ribs coming and stacking over your pelvis. And that is where you want to be. You want to try to avoid this because that's going to be a lot of strain on the abdominal wall. So tuning into your rib cage, tucking it under. So keep in mind it's not crunching in. It's just coming back to a neutral. And same thing with the pelvis. You're not like tucking under. You're just trying to stack your rib cage with your pelvis. Those are the key things to look out for. What's going on with your rib cage and your torso? What's going on with the pelvis? And then the shoulders are another one. So seeing if you're collapsing them because you're tired and maybe your job, you're on a computer a lot, and just rock those back. So all of these are going to add up and they're going to be exaggerated during postpartum. So I really want to make sure that you're taking care of yourself during pregnancy with how you stand. And you can look at my video on how to sit, which will review that during pregnancy as well. But when you're standing, simplest cue is think about that string pulling you up. And then if that doesn't seem like enough, tune in with a mirror as to what's going on with your rib cage and then what's going on with your pelvis.